so we have to, as physicians, be open to these other modes of healing people.
My biggest love is in the strategy of how to live longer. So when a patient comes to see me, I don't think about just what are the things that are happening with you right now, what are the things that might happen to you in 10 years or 15 years that might reduce your quality of life. The average American will spend 11 to 13 years in chronic pain or discomfort.
You're sometimes seeing these patients that are a little bit at the end of their road.
We have an entire generation of doctors that don't understand hormones and the complexity of hormones in women. At 35, our hormones start to decline. And there is no begging, asking, or anything you can do to have that not be a fact.
Today's guest has built one of California's most recognized and successful naturopathic clinics by tackling the complex health problems others often miss. Welcome, Dr. Renee Young, founder of the Young Naturopathic Center for Wellness in Los Gatos. Since 2002, she's specialized in functional medicine approaches to hormone health, metabolism, and longevity, integrating advanced therapies like IV nutrient support, peptide therapy, and hyperbaric oxygen. Her approach to treating the root cause of conditions using advanced testing and cutting-edge treatments has attracted everyone from patients who feel dismissed by conventional care to pro athletes like the San Jose Sharks. An educator, speaker, and longevity strategist, Dr. Young is proving that resilience is about building health that lasts. A mentor to colleagues and a love life kind of person, Dr. Young exemplifies both resilience and balance for herself, her patients, and the next generation of clinicians. Dr. Young,
thank you so much for having me.
I'm so happy to have you. So tell me what your most favorite thing to do in your clinic. What gets you excited? What kind of problems do you love to solve for patients?
Absolutely. Well, I have to tell you, my biggest love is in the strategy of how to live longer. So when a patient comes to see me, I don't think about just what are the things that are happening with you right now, what are the things that might happen to you in 10 years or 15 years that might reduce your quality of life. And I think about some of the interesting statistics that I've seen surrounding end of life, and that the average American will spend 11 to 13 years in chronic pain or discomfort at the end of their life. And that is absolutely heartbreaking to me. I often tease my patients, I want to drop dead of a proper heart attack over my 95th birthday or I'm going to be pissed. I don't want any other diseases or any other problems. I just want to go down quick, easy, and done. So I'm really passionate about helping deliver that to patients and allowing them to understand using their family history in conjunction with genetics, polygenomic tests, which are not something a lot of people do, and looking at their epigenomics, expressing to them what things are most likely to happen and what are the preventive tests and measures you should be taking now, especially in your fourth and fifth decade, to really get the longevity that you deserve.
I love that. And I know that especially women
Yes.
are looking for not just longevity, but like how to feel better, especially in that stage of life around perimenopause and menopause, where we all feel kind of crappy and we don't really have a lot of answers to why, and not a lot of treatment as to how to feel better. Tell me about that approach for you, because I know personally speaking that you treat a lot of women with some hormone issues and in that stage of life.
Absolutely. And you're right. It is one of my favorite stages of life. I think the thing that's a little misnomer, though, is that that stage of life starts a lot earlier than most of us think. So at 35, our hormones start to decline. And there is no begging, asking, or anything you can do to have that not be a fact. That's why for many of us, myself included, when I had my little guy, who's not so little anymore, over the age of 35, it says geriatric pregnancy. Well, I was not pleased to see that, to say the least. I was pretty upset, but it's a reality. So as our hormones start to decline, there is a very marked 4 years, but probably 10 years where women notice a lot of changes. And I think there's been a lot of misinformation. We all know, starting, I think about it a lot. It was July 7th of 2002 when Oprah got on and said, ladies, get off your hormones. You're all going to die of cancer. She didn't exactly say that. I don't want to say it like it was so bad. But the Women's Health Initiative really failed women. And we have an entire generation of doctors that don't understand hormones and the complexity of hormones in women. We have a medical system that primarily does studies on younger people and men. And it doesn't really show how women's bodies vary during that transitional time and how we can actually utilize our hormones to help us, not hurt us. So I'm really, really passionate about that. And I would love to jump into some of the physiology for some of our listeners here and talk a little bit more about how anyone can get the right testing to figure out what's going on. And there are a lot of smart, amazing doctors working in the hormone field, finding someone who, even if they don't know everything because they're new to hormone replacement therapy, helping educate your doctor to get the information for you to make informed decisions. So if that's a fun topic, I would jump on in.
I would love to get into that, but first, let's take a step back. You mentioned that women are starting to feel these symptoms at around 35.
Absolutely.
What are some of the symptoms that you're hearing about? Because we all know those, trendy words like hot flashes
of course.
And brain fog. But what else? What are you seeing when patients come see you? What are the first symptoms that they're feeling?
Absolutely.
And then, yes, tell me what's going on in their body. We want to know that pathophysiology.
I love all that stuff. Well, I mean, no one is a stranger to the midsection muff. It's like that little fat pooch in the middle section that won't go away. That's usually the first sign of you're starving yourself to get there. And I actually think you once said to me, the white knuckling, the scale for those 15 pounds that finds you, and every time you lose them, they come back with friends. Rude. Yes. Not invited, completely not invited, and do not want them. Fatigue, but not the type of fatigue that's oh, I didn't sleep. Life fatigue. And I have a lot of women use these words with me. I am just life tired and fed up and an intolerance. And it's not the moodiness of PMS. It's just that feeling of do I really have to do this too? I think that sometimes as women, we're thankful for our families and for who they are, but we begrudge them a little bit. Can we say that as women?
Absolutely.
For having to pick up their stuff and do their things. And it's you get to that point where there's no joy anymore in helping people. So it's a kind of a mild depression. And I think that that's something that people don't recognize. I also think that midlife, it's really interesting, even from a friend standpoint. A lot of us move from our, maybe our high school, our college friends, our family, to the friends of our children's friends, and
it's an odd jump, right?
It's a lonely time in life. Yeah. It really is. So I think women will often start to express mood things, and then physiologically, body aches are something that comes up. Exercise intolerance, hair loss. Sometimes women will tell me, my hair used to grow to the bottom of my back, and it only grows so long. And there's a lot of hormonal process that happens that our body will start to shift there. So those are the things you should be on the lookout for. Also, the other sneaky one is irritable bowel syndrome.
Oh, yeah. Okay.
So I often tell women, if you touch the tip of your nose, these are your intestines before you go through menopause. This is what they feel like afterwards. This is why you fart when you walk. Just do that, okay? So farting when you walk, IBS, yes. Other human intolerance, not a pretty picture.
Yeah, I hear you on some of these symptoms, and I think part of the problem is, as we're having children later in life, like you mentioned, the
Absolutely.
geriatric pregnancy, we don't know what's going on. We don't know if we're postpartum, if we're just in that season of life where we're waking up because of our kids, or we're just doing a lot for our children that are still young. And so I think a lot of us don't even think that this could be perimenopause. So tell us what's going on deep inside our body. Tell us what's actually happening.
Absolutely. And I have to amen to that. That is just so true. And going from your biggest hormone high to the biggest hormone low, having personally experienced that, having my son at almost 36, it's real.
Yes.
It is totally real. And I think that one of the things that a lot of women don't realize is that our hormones are all deeply interconnected. So I always talk about the whole body hormone approach with women. So there are 3 different types of hormones that we have. We have steroid hormones that everyone thinks about as estrogen, progesterone, and testosterone. And then we have amine hormones. That's your adrenaline, like your epinephrine, your norepinephrine, but also thyroid hormones. And those come from proteins. Steroid hormones come from fats. And then we have one of my favorite things to talk about, peptide hormones. And yes, it's true. Peptides are hormones. Not always. Not all hormones are peptides and not all peptides are hormones, but they're really related. So what happens in midlife is estrogen, primarily produced in our ovaries, is aromatized from testosterone and androgens. If anyone's familiar with polycystic ovarian syndrome, that's when women have higher testosterone, lower estrogen, and they become insulin resistant. Why? Your body fails to aromatize testosterone into estrogen. That's where you see fertility failure. Progesterone and estrogen work very, very differently in our body. Estrogen can actually get deep into the mitochondria of your cells and have deep cellular changes, whereas androgens don't. So women lose the ability to aromatize. When you lose that ability to aromatize your estrogen in the beginning of our cycle, or the follicular phase of our cycle, actually stops glucose from being produced in your liver and being released into your blood. In the middle of your cycle, when your progesterone spikes, progesterone does the exact opposite of estrogen. And this is also why women have varied responses to hormone replacement therapy. So progesterone actually enhances that process. That's why progesterone increases cravings. It increases abdominal weight gain. And those things are very important when your body is preparing for a baby. But right around 35, when your ovaries say, girl, I'm going to quit my job one day, you better get your company ready, because when I go, you're going to have a lot of things to do.
Yes.
So when that happens for women and they lose that positive effect of estrogen, they become more insulin resistant. And insulin resistance and estrogen kind of go, hand in hand, the loss of estrogen. So in that midlife area, a lot of women will take testosterone before estrogen, because testosterone, if you give it with the right micronutrients that help to aromatize testosterone to estrogen, what you see is they get the benefits of estrogen without having to take estrogen. And, as doctors, we know taking estrogen too early can increase your endometrial lining, cause uterine, what's called hyperplasia, and increase your risk of uterine cancer, which we do not want to do before someone's menopausal. So as you start to look at your own hormones, thinking about, where are my androgens at? Where's my testosterone at? Where's my progesterone at? I 100% understand these things vary throughout the month, but they should always stay within a normal physiological range, which we have those. We have that established as doctors. So taking a look at those things so that you can plan forward is really important. On the other side of that, understanding how your body regulates insulin. We all know that we vary in how we regulate insulin, right?
Absolutely, yes.
Cortisol, our main stress hormone, when it goes up and spikes, now we're going to talk about those kids, we're going to talk about that husband, we're going to talk about tired, we're going to talk about farting when you walk,
yes.
All the things that you're like, this smack cannot be me, it hits you, and it hits you hard. And your cortisol levels spike, and when that happens, insulin's like, I'm going to help you. I'm going to jump in the bloodstream. I'm going to get as much sugar as I can. I'm going to shove it in your cells as fat, and it's not going to be your boobs, girls. It's going to be your belly. It's just not.
And I see this even in my orthopedic office, because I see women of this age getting very frustrated that they are trying to work out, and now their knees hurt a little bit because they're holding on to a little extra weight. Mm-hmm. And that word, they're white knuckling it at a certain weight. They cannot lose the weight. And it's this vicious cycle where, of course, I talk to them about nutrition and that's 80% of it. But that is not what you want to hear.
No.
It's not what you want to hear. And when your joints are achy anyway, or stiff because of that decrease in estrogen, you just feel powerless.
Absolutely.
You can't lose the weight. You can't get moving, as your sports medicine doctor is trying to tell you. And it just feels like this cycle you can't get out of. So what's your approach to treating those patients? And also would love to know what the role of GLP-1s in all of this is.
Absolutely. Well, I was moving towards the GLP-1s, but let's just put that in our pocket for a couple minutes as a teaser here. So one of the other things that I do with my patients is I test their VO2 max. Why is VO2 max important in this conversation? VO2 max measures the amount of oxygen coming into our body and CO2 coming out. It's called your respiratory exchange ratio. When you look at your RER, you can tell if someone is burning fats or carbs. Your protein amount is kind of a consequence of that. Like, protein isn't really set by RER, but I can tell whether or not someone is fat burning or not. When you're not fat burning, it's a sign that your hormones aren't working appropriately, right? Yeah. Interesting stuff. What else does oxygen do? Oxygen heals all of our tissues. It literally is the only thing that we truly can't live without for more than a couple of minutes, right? So when we take it down to it, and we know that oxygen is necessary within the mitochondria to make respiration happen. When everyone is like super excited about NAD and all this fun stuff, did you actually know that estrogen utilizes oxygen and NADPH to donate an electron in your mitochondria to form ATP, which is energy? Why do you feel tired? I could go through the physiology with you, but it's your estrogen declined, right? Yeah. It's kind of cool when you see how these things all work together. Now, I want you to think about and picture a red blood cell on someone who has a high hemoglobin A1C, which is the measure of your blood sugar over the last 3 months, versus a low one. It'll look like a big round disc with yellow dots all over it. The more glucose you have on your red blood cells, the less you can perfuse oxygen. This is how VO2 max tests your biological age. The less oxygen you can get, the older you get. That's all there is to it. So perfusing oxygen to tissue is a really, really important part of someone being able to heal. If you can't do those things, what happens? What hurts? You as an orthopedic surgeon know more than anyone. Tendons have a high amount of nerve innervation and a low amount of blood flow. Following me here?
Absolutely,
So
yes.
now, how beautiful is this marriage between GLPs and estrogen? If you take a GLP and you lower the amount of glucose load on your red cells, you actually perfuse more oxygen to your cells. Yeah. I don't hear a lot of people talking about it like this.
They do not, and I will insert here that I remember years ago, because me and you are friends, and we live in the same area.
Yes.
And we love to share patients and stories, and then also just have fun together, obviously.
Of course.
You were telling me years ago about GLP-1s, before it became such a trendy thing right now. You were telling me years about it, years back about it.
Well, I started prescribing them in 2014. So, when I was 3.
Yeah.
So I'm just saying for a friend.
Of course,
when I was 3,
yeah.
of course. And when I first started prescribing them, I have to totally kiss and tell. Patients teach us so much more than books. And you and I both know that as clinicians, and we have both been around the block a few times. I started seeing patients clinically in 2000, so 25 years ago is when I started seeing patients. It's a long time. And this wonderful woman came to me, and we'd been struggling with her PCOS so badly. And I mean, as a clinician, it's heartbreaking. You're watching someone count every calorie they put in their mouth. I had all the fancy herbal stuff because berberine actually mimics how GLPs and metformin work in the liver. I gave her all the dirty hippie drugs I could find. I put her on birth control. I put her on spironolactone. I did everything. This poor woman could not lose a pound. Could not lose a pound. She went to Europe, and she came back with this product, however you want to say it, semaglutide, however you want to pronounce it, you pick. And she had lost a massive amount of weight, and I was just mesmerized by this. And when I started to read about glucagon-like peptides, it made sense to me. These are actually hormones. They're the hormones that oppose and work with insulin. And because glucose, insulin, and estrogen have such a deep relationship with one another and how they work, I really saw, oh my goodness, this is the key to unlocking fertility in women who have PCOS. We have to give them back their estrogen so that their ovaries aren't flooded with androgens, their ovaries don't become cystic, and they have the ability to bear children, which is really the hardest part about PCOS, is when you have fertility issues and you come to that point in your life. So when I learned about GLPs, I thought this is the best thing since sliced bread, only I couldn't get somebody to pay a couple $100 per injection, which is really kind of funny, right?
Yeah, now looking
at that, it's pretty funny because I have patients who I prescribed it to once upon a time saying, can you get the old price? And I just laugh. I'm like, it's gone, kids. It's gone. It's not there anymore. There's no such thing as that anymore. So with that said, naturopathic doctors, we're taught to look at pathophysiology of disease and look at the functioning of the body to find a solution for someone. We often, will lean someone towards medications or prescribe them if they need them. Sometimes using natural stuff, it's not enough for someone. So when it comes to GLPs, I love these medications. I think that sometimes they're a little bit overused and not really quite understood completely as to how they can benefit someone. So I do a lot of microdosing on GLPs in my clinic. I like to utilize it as part of an introduction of hormone replacement therapy, especially testosterone, because I don't want to make women have PCOS, right?
Of course, yeah.
So early hormone replacement therapy, if you do too much testosterone, you can have hair loss, you can have acne, you can have all kinds of problems. You need to balance that out for patients. You need to make sure that you find all of the other solutions that they have. So I'm really super excited that we have all these different buckets that we can dip in for women, and that we have the easy ability to test their hemoglobin A1C, to test their insulin levels, even to test them for things like leptin resistance, which I'm not sure how much you talk about ever, but leptin resistance is when your body holds on to extra fat because it doesn't know you have enough, right? Mm-hmm. And that's because your body doesn't trust what's happened. It often has to do with chronic issues with cortisol and epinephrine. Steroid hormones and amine hormones can negatively affect your peptide hormones. That means cortisol, steroid hormone, all of your thyroid hormones, your epinephrine, norepinephrine, your amines will negatively impact peptide hormones. Insulin is a peptide. A lot of people don't realize that. Glucagon-like peptide, GLPs, help utilize insulin in an appropriate way to keep the fat off of your belly. It's still going to go on your butt if you eat too much. I can't help you with that. I've tried to help myself with that. It's not.
It's a no-win situation.
I found no help for that. I'm like, stop eating all the good stuff. But yeah, it's really cool that we have all these tools as women to really help ourselves. And I've got to say, let's say this out loud, for men, it's the same thing. When men start to have hair loss in testosterone therapy, why? They've over-aromatized to estrogen. That's how they get moobs and testicular shrinkage. Two things I regularly talk about in my clinic. You do not want those effects of testosterone as men. You would like to have a flat man chest and normal man parts.
Absolutely.
So, again, understanding this physiology is what's so important. So we start out, again, VO2 max testing for patients. We do a little bit more testing on their mitochondrial function by looking at what nutrients are high and low, along with a full hormone panel. So it's pretty interesting, cool stuff.
Yeah, so you've touched on a lot here, and one thing that I am getting from this also, you're sometimes seeing these patients that are a little bit at the end of their road. They have they have gone the traditional medicine route, and maybe they're not getting the answers that they want. That is in some ways a lot more difficult because you are seeing these patients after they've tried a lot of things that are not working from them. So tell me your approach to that and how you work with traditional medicine as a naturopath.
Absolutely. Well, and two things with that. I have to give mad props to I'll call them the oldest of my millennials, my women in their mid-40s. They come in like savages. They know everything. They have templates for me. They have spreadsheets. They know.
They have Googled a lot.
They have used the Googles in all the ways. So I'm also going to say that my boomers and my Gen Xers, there is a deeper level of desperation. We didn't grow up with the amount of information that's now available. Some to the positive, some to the negative. So it is really difficult to deal with. And as you know, you've known me for a lot of years. I play very nice in the sandbox. I have lots of medical doctor friends, and when I don't know something, I reach out and I have someone help me. So I often work collaboratively with other functional medicine doctors, with medical doctors. Not one person can know everything. Right?
Absolutely. Yeah.
And, I say this all the time. I graduated med school in 2002. You couldn't really even test genetics very well commercially until 2004. What does that tell you about your doctor that's in their 50s? We had to learn a lot on our own, just like our patients did. So, dealing with it as a strategist, first, it's always encouraging patients. Your doctor is doing the best they can with the tools they've had. I will often tell patients, you wouldn't go to Pete's Coffee and demand they give you a hamburger.
Yeah, it just doesn't work that way.
The system of medicine is there because the masses need care. And I really want to say this and be really intentional about it. Public health and longevity medicine are very different. There has been a really, really bad marketing person working on the part of medicine and the insurance companies. I would offer to help them, but I have a full-time job already, so I can't do that. But they need to market better. We have an amazing sick care system. If you are sick, we will help you. If you have been hit by a car, we will help you. So the problem is my boomer generation, my Gen Xers, we were taught that a doctor can help you with anything you have wrong. So we consult our doctors like our best friend. We would say, okay, this happened first, and then I was tired, and then my kid's this, and then I was farting when I was walking, and then I peed my pants a little bit. Can you help me? And they're like, you don't have a heart attack coming? You don't have cancer? Good luck. They leave frustrated. So sometimes their frustration is they just didn't understand how the system worked and how to make it work for them. So I often advocate that my patients utilize anything they can within their insurance and with their primary care doctor or with another specialist to get the information they need so I can help them get a detailed strategy so they can actually move forward with it. And I think a lot of the medical doctors and other functional medicine doctors that I work with, they really appreciate that. They appreciate a collaborative approach. Whether it's a urologist with prostate health, I see a lot of men that have issues, and when we do full body scans through different companies, there's a few different ones I use, and we find things like a small nodule on their prostate. I send them right over to a couple of my favorite urologists. That's not a case that I'm going to deal with. But then when I do have cases where men might have just basic, hypertrophy of their prostate, I'll get them back and we'll do some other lifestyle things. If they have cancer, I'm working with the oncologists, any number of them in my area, whether they're, at PAMF or Stanford, wherever it is, to help get that person on the right path to be cancer-free, and then help them with things like radiation damage, which hyperbaric is FDA approved for radiation damage, and that's why we onboarded hyperbaric therapy, because seeing so many men with testosterone therapy, I do see a lot of prostate cancer. We do see a lot of people who've had breast cancer in our clinic. So we want to be able to help them when they go through radiation. So again, that's just part of the vertical integration I've chosen for my clinic. But, again, going back to this stuff is so cool how it works together. And I get hard cases because the system is hard for doctors to work in. And I say that with like a very deep heart of like, I have so many medical doctor friends that are like, I need you to order this test for me, Dr. Young. I work for insert X place, and they don't allow us to order this test, and I know you can order it for me. So I act as an advocate for a lot of my medical doctor friends, and I break it down. You need a calcium score? What is it, $150 in our neighborhood? It's not that big of a deal. There are a lot of places it's as cheap as $65 where people are living. So I try to really help as much as I can so patients get the information that they need.
I think we're living in this world where people are not going to accept that there isn't anything they can do before they get sick. And so I think there's a lot of preventative medicine happening, a lot of regenerative medicine happening, preservation, wellness. These are all like trendy words, but they really, what they get to the core of is that we are not going to accept just getting sick, as you mentioned. We are going to try to prolong things.
Absolutely.
So tell us more about that. What, outside of the hormone therapy and the GLP-1s, what are people coming to you for in terms of, I actually feel pretty good, but I want to keep this feeling that I have? Mm-hmm. And how am I going to utilize what you have to offer so that I can play my sport harder for longer? Mm-hmm. And, now I've got grandkids and I don't want to just be sitting around while they're playing next to me. I want to play with them.
Yes.
So what tell me about those patients and how you're approaching them.
Absolutely. So I call them my longevity cases. So we start out with what we call an executive wellness check. So it's just a head to toe check. And I'll tell you, I have a lot of patients interested in this. And, whether it's with myself or anyone else, again, I go back to figure out what you think might get you, and then look at the tests you might need to invest in for that. So I shamelessly say this all the time. Cancer or a brain aneurysm will likely get me, right? So what do? Preventive things for my vascular health, and I'm really up on my cancer care. Not everyone needs to be, right? But like I personally do a full body scan every other year with a cancer screening test. It's a blood test that I do. So I talk to patients about that.
You have a strong family history.
Very strong family history. I'm like ridiculous family history. Like every time I turn around, I'm like, oh, another person with cancer. There you go. So, and even some people that have genetically related cancer. So with that said, that for me is a big deal. I have other patients where heart heart disease is a big deal. And there are all these cool like CTAs out there, which is you're basically looking at your heart and looking at your blood vessels with AI, so you can see where plaque is building up or calcium scores. So we come up with a plan of what are the things you need to prevent, what are the tests you need to know, whether or not you need to worry about it. I mean, there are even polygenetic risk scores for Alzheimer's disease that look at multiple genes across the board. If you're very concerned about something, which many of us are, we get down to the nitty-gritty of how worried do you need to be based on your current health, and when do you need to check in again? And look at a plan that works for someone. And I say this to a lot of functional medicine doctors. Make sure that you have the ability to work within someone's budget for them. Not everyone has a capability to do all of these tests, but you need to help your patients advocate for themselves. Give them avenues where they can get other tests. If you can't order the test for them, advocate for their doctor as to how they can do that for them. So we start out with, again, testing, and then we look at what things might help them to live longer. So many doctors know this, and I think the public sometimes escapes this. When a medication or something is FDA approved, FDA approval is for safety, and there is specificity to what drugs are used for. But as doctors, it's our right to use a drug for some level of off-label use. I'm going to use birth control as an example. I used it for acne at one point in my life, right? Like, people don't always use drugs for a particular reason. So there's different categories of longevity medications people like to be on. So metformin used to be one of those drugs where patients would come in, I would prescribe metformin to them because it's a longevity drug. I've replaced it with microdosing GLPs for them to help them with their glycemic control or their blood sugar control. What does that do? It increases weight loss. It amplifies their ability to work out harder and stronger. And then we layer in peptides and I'm going to say early on, like I'm going to call it pre-perimenopausal, which is like the few years before it gets bad where you start seeing weight gain and other things. I'll often give patients things that will help amplify their growth hormone. So some peptides help you to release growth hormone. Some peptides actually are growth hormone, like genutropin or something like that you would spend in the market forever. And then there are what we call the morulins, like ipamorulin, samorulin, tesamorulin, that help your body to release its own growth hormone, which can help you sleep better, which can help you build muscle. We do an analysis of someone's sleep as well to see how well they're sleeping so that you can, figure out if sleep apnea is contributing to things. And then just start to work around all those different categories of what could be going wrong. We'll layer in IV therapy and nutrient therapy based on a combination of genetics. Like 40% of us genetically don't use our B vitamins very well.
Sure, yeah.
How many docs know that low levels of B12 actually can cause chromosomal breaks? You can get neurological symptoms. You can appear demented, which is what I blame anytime I'm doing something crazy. I'm like, it's my B12. It's not me. It's definitely my B12. So, just being able to look at those things as a clinician and make educated decisions for patients, sometimes it's easy stuff. And then I also advocate that my patients, depending on their age, if you're under 45, we usually do blood work once a year. If you're 45 to 55, when I look at the CDC statistics of when disease develops, did you know at 55, 30% of us will have one chronic illness, but by the time we hit 65, 70% have one, 50% have two, 30% have three and more. So when does it start? Between 35 and 45, disease starts to puff its chest and be like, I'm going to get you. Yeah. 45 to 55, that's when it rears its head, often. 55 to 65, you get more of a presentation if you're going to have a problem. So I really advocate that patients check themselves regularly for some of those things, and particularly for men and women, mid-40s to mid-50s, look at your hormone health. If that starts to decline, you want to catch it before it catches you. You've heard the expression, if you don't use it, you lose it. Let's think about bone health with women. If you lose muscle mass and you can't hang on to that tensile strength and you lose bone health, while I am magic only on Tuesdays after 5 o'clock, I cannot get your bone back very easily.
It takes years and years, and I think that's part of the problem. Yesterday, I actually saw a patient with bilateral proximal humerus fractures. This is not something you see very often. And I said, how did you fall with bilateral proximal humerus fractures? And she said, I didn't fall. I was walking on one of those stair steppers with the hands, and I sort of tripped, and I just latched onto those handles, and that pulling sensation is what popped her greater tuberosities.
Oh my goodness.
Off her proximal humeruses. And so she was asking me, what can I do for my bone health? She's, in her 60s. And I said, there's a lot you can do for your bone health. But what I really, I didn't want to say this to her, this all starts really early.
It does.
You have to start building that bone early. You have to do the resistance training. You have to do it early. So I love that we are focusing. Menopause is having a moment right now. We know this in the media, which is great because it's bringing awareness.
Love it.
But what I want to happen is for women in their 20s and 30s, even in their late teens, is to recognize that there are things that they can do now. So tell us about some of those things that they can do at an earlier age.
Absolutely. And I just want to say I'm heartbroken for your patient, because this is where, when you look at what's happened historically with hormone replacement therapy, she was generationally failed. She was failed by a generation of doctors that were so scared by the information they were given that they would hurt someone. They weren't malicious. They were just so scared to hurt her. They didn't know that estrogen is FDA approved for the treatment of osteoporosis. How about preventing it?
Yes.
How about that? So I agree with you 100%. And I think that, girls and boys, their growth and development is different. Before your bones are completely formed, which you can talk about for hours more than I can, I don't really want people lifting too heavy before that. But once your bones, your skeleton is set, you should be lifting heavy and hard.
And often.
You should be building muscle. And also the thing about it is that a lot of times people feel like they need this hour and a half in the gym with the perfect outfit and everything else. Do you know, when I think about people who live to be over 100, I'm advocating for the gym, advocating for it hard. They don't go to the gym, right?
Yeah, because they're just active in their normal life every day.
So one of the things I really think about that you can do that's really great in early life is make sure that you're doing interval training. When I think about people who live to be over 100, they do interval training. They're going up and down hills and with heavy things. So I know that you and I have talked a little about weighted vests, and thank you so much for giving me that great tip of you can't just wear it around the house like, some kind of decoration, because that might have been what I was doing. I'm just going to admit it might have been an accessory for me for a little bit. And I was like, you know what?
Makes you feel good.
Dr. Mehta's right. I can't just wear this weight and then take it off and feel like, wow, what a relief. I must have worked out. No, it's not what works. So, jumping up and down, moving around a lot, doing weighted exercises. And then I'll also say something that a lot of people miss in early life, not just for bone health, but for neurological health, is proprioceptive exercises. And I already know that your orthopedic brain is going, oh man, she's talking about it this way. When all of those little muscles in your spine, your multifidi muscles and everything else turn off and you're working just on your big muscles, you get more muscular skeletal pain. So when you're younger, do proprioceptive exercises, do balance exercises, balance with weight. These are really, really important exercises. And I really feel like this, hour and a half at the gym kind of sort of thing, it's not necessary for everyone. I love the gym. I don't want to be down in the gym, you guys. The gym is awesome. But sincerely, if you have 5 or 10 minutes, you can work out.
Absolutely.
You can pick things up that are heavy, and
it's also not sustainable, the hour and a half. I mean, especially as we get to this stage with kids, it's hard to find that time, and then we just don't do it at all. And that is not the right attitude or strategy for that.
Or you go to the gym and you hide in the sauna and in the hot tub and act like you worked out. Not that I've ever done that.
Well, there are some studies to show that the sauna is really helpful, correct?
It's very helpful. And personally, I start every day at 10 minutes in my hot tub and then a cold plunge.
Okay, tell me about that routine.
I love
simple, easy for people to do.
It's simple and it's easy, and even if you don't have a cold plunge, you can do it with, some people will buy large coolers and they'll fill it with literally a garden hose full of water, it'll be nice and cold for you. They'll jump in their shower that's hot and then dip in the cold. Cold, it's an interesting thing. When you have heat, it brings all the blood to your muscles. Cold drives all of the blood back into your organs. So it gives you a natural lymphatic massage. So I do it for a couple reasons. One, nothing wakes you up like water that's 42 degrees, which is what I dip in every morning. It's really, really stimulating. I can avoid coffee with this stuff. So I do it primarily for body aches and to keep my joints healthy and to make sure, the hot water pulls blood out to my joints and things, and then the cool water drives it back in. What is that doing? When we think about all of our inflammatory markers, like our white blood cells and things that live in the spaces when you're inflamed, what are they doing? They're driving back into your body. You're allowing more blood flow to come in and flush it out. So I really do it from just physical and mental health. And then you feel mentally strong when you can accomplish something. And I say this, and I think you can feel mentally strong whether or not you've ever had children. But I think it's interesting. Sometimes I have some moms are like, I can't get in a cold water for 30 seconds to 3 minutes. I'm like, girl, you had a baby.
Yes, it's true.
That is hard. I would say, take it like a woman. That's what I'm going to say. Use your big girl biceps and let's do this. So I really love that. There are a lot of really simple things that we can do. I think that having a mindfulness practice in the morning is important for people. So for me, in the hot tub, I always set my day with intentions of what I want to do. Even my alarm. Do you know what my alarm says when it goes off in the morning?
What does it say?
Helping people.
I love that.
Literally,
Yeah.
I have a tag, helping people. Remind yourself what you're doing, why you're doing it. Get yourself in a space where you're ready for your day. So for me, it's obviously about aches and pains in the cold water, but it also just gets me ready for my day. So that's one tip I can give people that they can do just for their overall physiology. Interval training, weighted training, heavy lifting, all really, really important, and balance. I think sometimes being safe and like holding onto a bar or something, but exercising while you have one foot up, try closing your eyes for a minute, see how your balance is. With the way the world is moving with like AI and all kinds of cool things, I think you and I have chatted once or twice before about how even certain cell phones and things will tell you if someone's gait is off. And not just on Saturday morning when you were out Friday, because I'm going to just encourage a few of you to look at your gait on your phone after you've been out on a Friday night. And it might say your gait was irregular yesterday.
Absolutely. Yes.
Exactly.
Yeah.
So, and I know that you and I have talked about, even as a surgeon, like how cool it would be after you did surgery on someone if ever you were to like get that information. Like, how is your gait doing? What are those things doing? Because again, if someone has weak, small, proprioceptive muscles, healing of your larger muscles is harder.
It's going to be very difficult. We see this all the time with those CrossFitters who are doing a lot of overhead activity.
Yes.
They're not really working on those tiny rotator cuff muscles, just stretching and strengthening them with bands. It can be boring, but it goes a long way for the bigger muscles around it. It's very important. So Renee, tell me now, I would love to hear what do you see coming? What trends are really hot right now? Where is this all going? Because we talked about how longevity
Absolutely.
wellness is so huge. People are not going to wait to get sick. So what's coming? What's on the horizon?
Absolutely. So I think I see, just from like a technology standpoint on the horizon, a lot of the full body MRIs and things are getting even better about detecting cancer. There are a few newer ones on the market that we're not sure kind of where they're at yet, but I'd be on the lookout for what type of testing you can get from a full body MRI standpoint. When it comes to peptides, I'm going to say that's up to the FDA at this point. Like a lot of peptides that are not approved, they're hard to get. Sometimes people go outside the country to get them. Sometimes people use them from compounding pharmacies. Everyone knows that the GLP medications are coming out with things that also affect your receptor sites. Those are the GLP-3s that are on the horizon. So that's definitely big. In the longevity realm, I'm going to say it's really anybody's game, but I feel like technology is coming to the point where you're going to be able to look at your data and own your data as a person, as I deeply feel that you should. You're going to be able to look at your labs and your wearables and everything else and integrate them in such a way that you can detect how you're living. So I would say keep looking at technology. Make sure that if you're using AI with things, that it can detect the nuances across tests. It's still, it's still in its early infantile stages, but it's going to be something in the tech realm. And I've also heard that some of the bigger companies that are utilizing peptides now might take on some of my favorites, like BPC 157, which is known as the Wolverine peptide. And it helps you to heal your body a little bit faster. It's specifically used for tendinitis. There are even some studies on it healing things as hard to heal as an anal fissure. Like there's a lot of stuff that you can heal with BPC 157. So it's going to be in the peptide space, and I'm excited to see what happens. And I'm excited to see a generation of people who are not willing to take no for an answer when it comes to feeling better.
I agree with you on that. And I also have to say here, for a lot of physicians listening, people are coming and asking these questions. So when they're coming to my office and talking about orthopedic injuries, they're asking about the peptides. They're asking about regenerative medicine. And for for people who have commercial insurance, They have to understand that things like PRP have been around forever, for
Yes.
30, 40 years at this point.
Yes.
And insurance still does not cover it. So it takes a long time for commercial insurance to cover some of these things. And so it's a fallacy to think because insurance doesn't cover it that somehow it's not as valuable or as
Absolutely.
effective. And I think that I am recognizing that more and more as my patients are coming to me and asking for these. We call them alternative therapies. I don't know
course.
that they're alternative therapies anymore.
Right.
They are therapies. And so we have to, as physicians, be open to these other modes of healing people and treatments that may not be approved by insurance or paid for by insurance. And so we have to have knowledge over those things because our patients are more knowledgeable. So Renee, this has been great. Thank you for joining me today.
Absolutely.
Tell everyone where they can find you and maybe any exciting projects that you're working on that you want to share. But just tell our viewers or listeners about that.
Absolutely. So you can always find me on my website at youngwellnesscenter.com. And from there, you can get to our Facebook and our Instagram and everything else. So that would probably be the easiest way to find us. Fun projects and all kinds of things. There's always something. As you know, I just got done with my hyperbaric clinic. It's been a year. So that's been my big baby and my big love.
I know personally how hard you've worked on that.
Yes.
And it's been just a labor of love for you to just, get it compliant and working and helping people.
Absolutely. And I will say, a lot of times, sometimes inventing something old to be something new is what's on the horizon. Hyperbaric has definitely been a hot topic lately in the wellness industry. So I'm sure that you'll see more from my clinic on integrating some of these different strategies and coming up with bigger plans for people.
I love it. Thank you.
Absolutely. So great to be here.
Thank you for tuning in to The Resilience Factor. If you're ready to build a stronger, longer-lasting body, make sure to subscribe and share this episode with someone who's ready to thrive. You can follow me at Dr. Pamela Mehta for more expert tips on strength, recovery, and orthopedic health. Until next time, stay strong, stay smart, and stay resilient.